China has identified the cause of the mysterious new virus.
Coronavirus.
There are fears a rapidly spreading virus has reached Australia.
This is a rapidly emerging situation where there is not a cause for alarm.
The first US case has been detected.
There's confirmation the coronavirus has reached Australia.
China is urging its citizens not to travel abroad as it struggles to contain the virus.
We will be standing up Christmas Island as a quarantine area.
Foreign nationals coming from China are now banned from entering the country.
I have today declared that the coronavirus presents a public health emergency in the United States.
Now has risen above that of the SARS outbreak 17 years ago.
We now have a name for the disease, Covid-19.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody.
As of October 22, 2022, the virus has claimed the lives of over 6 million individuals worldwide. The impact of the COVID-19 pandemic and ensuing social restrictions has been profound, affecting the health, livelihoods, and well-being of populations worldwide. Studies have shown widespread effects on mental health with an increase in stress, loneliness, and depression symptoms related to the pandemic. Given the seriousness of the virus, the public has understandably looked to the media to keep them informed and safe. Media was the key source of information during COVID-19, a place where you could listen to the guidelines and recommendations of national and international authorities. Misconceptions, exaggerations, and even denial of COVID-related news in the media have impacted global mental health, signifying the need for credible information. Mass media, print, radio, television, and the internet has never been a more extensive broadcasting tool. During a public health crisis, the media directly impacts individual behavior positively and negatively, affecting people of all ages. Consequently, if information about COVID-19 is exaggerated or full of misconceptions, then the media can cause alarm in the general public. What is misinformation? Misinformation is incorrect or misleading information that is deliberately intended to deceive. Misinformation spreads quickly and widely, and digital media makes it more difficult to identify and verify facts. According to research, social media and the spread of misinformation are linked to mental health issues such as fake news causing worry, panic, and paranoia. Media pollution, which can intensify anxiety, concern, insecurity, and frustration, is undoubtedly linked to misinformation and fake news. In this perspective, the media is viewed as a double-edged sword. It may either contribute to the misinformation load or contribute to health awareness and collaboration. Although social media plays an important role in modern life, its popularity during the COVID-19 pandemic has raised concerns. While the coronavirus ravaged the world, individuals primarily use social media to absorb the news and interact with their friends and families. However, a large amount of misinformation, much of it frightening and alarmist, may have led to the emergence of a new disorder, COVID-19 anxiety syndrome. The World Health Organization has previously said that the infodemic surrounding COVID-19 spread just as quickly as the virus, with conspiracy theories, rumors, and cultural stigma contributing to deaths and injuries. Lead author Roy H. Perlis, MD, MSc, Associate Chief of Research in the Department of Psychiatry and Director of the Center for Quantitative Health at MGH, said, "One of the notable things about depression is that it can cause people to see the world differently, sort of the opposite of rose-colored glasses. That is, for some depressed people, the world appears as particularly dark and a dangerous place. We wondered whether people seeing the world this way might also be more susceptible to believing misinformation about vaccines." His colleagues examined responses from 15,464 adults from all 50 U.S. states and Washington, D.C., who completed an internet survey between May and July 2021 that included statements related to COVID-19 vaccines after answering a questionnaire that measured depressive symptoms. The team found that levels of depression are at least 3 times higher than they were before the COVID-19 pandemic. Participants with moderate or greater major depressive symptoms on the initial questionnaire were more likely to endorse at least one of 4 false statements about COVID-19 vaccines on the subsequent survey, and those who endorsed these statements were less likely to be vaccinated. The results in no way blame misinformation on people with depression, but rather suggest that depression may cause people to be more vulnerable to believing this misinformation. It is crucial that people who are looking for reliable information regarding COVID-19 understand that some online content on the subject is not reliable or evidence. Media should not disseminate any news, videos, or images that may mislead the public or put them into a state of emotional turmoil. Instead, the aim should be to mitigate the harm from misinformation and promote healthy public behavior. Don't let yourself absorb the misinformation and don't let yourself spread the misinformation. It only does more harm than good. Life is clearer and more positive when you know what you're reading and putting out into the world. Ways to spot fake news. Develop a critical mindset. Consider the source. See who else is reporting the story. Read beyond the headline. Is it controversial? Check the author. Check the date. Check your biases. Is there a hidden agenda? Check the facts.